Hello, thank you for tuning in to the Katie Sassine Show. I'm Katie Sassine, your host, as always addressing the indoctrination of the nation. Remember, you can follow me on Twitter at Katie, FYNTV, and email me with comments, suggestions, or questions at katie@fetchernews.com. So, yesterday we had talked about how the mass media is relentlessly continuing to report an anti-Trump narrative. They are talking about Trump not having a dog in the White House as being a relevant issue, and also his trips to his own golf course as being an issue, and comparing his golfing outings to those of President Barack Obama's. And obviously there are two situations that are not comparable for various reasons. If you'd like to check that out, please check out episode 1 from yesterday. And today we are continuing to talk about the failure of the new healthcare modification, the new healthcare bill that would modify Obamacare or the Affordable Care Act, whichever you prefer to call it, and the failure of that bill to pass through the House of Representatives. Now, it was very low on support, so it failed as predicted. Everyone kind of felt like it was going to fail before it actually happened, and it seemed that what happened with, this bill, Paul Ryan's bill, to modify the health care, to modify Obamacare, is that, they rushed failure, and what they needed to do instead was just be a little bit more patient to urge, the constituency and supporters of Trump to be more patient and give us more time to develop a more cohesive plan to disassemble Obamacare. And they've stated that an opportune time to, get back to this bill, because they will get back to it at some point in the near future, would be in the fall when the premiums for Obamacare rise again. And as we know, it's not an affordable act, it is an expensive care act. So, I don't usually say Affordable Care Act because it's not affordable for the average American man and woman. It's just not. So, anyway, the process of the repeal, we'll go over that in a second. First, let's go over the pros and cons of Obamacare facts on the website. Now, here we are on ObamacareFacts.com, and we scroll down slightly. We've got, discussing the pros and cons intro. There's a little video they show, and you can watch it in cartoon, and there's a pros and cons list. Now, I'm checking out the cons, but even on the pros, I found some cons, such as the microchip. But anyway, we're focused on the cons. So we all know the higher taxes is there. That's the first box. We also see that, those who don't get the Affordable Care Act will have a fee, and it's going to be more complicated to shop for coverage because of the transfer from privatization to government health care. And just, there's much more to it. It says CHIP also uses federal and state funding. It's just, it dips more into the taxes and what the people are paying for, and that's not what the people want. They don't want to continue giving the government all their money to take care of everyone instead of making their own money to take care of themselves. It's basically the gist of everything. So just wanted to show you this website so you'd have an idea. You can check out ObamacareFacts.com and get an unbiased, or as unbiased as it can be, pros and cons list. Anyway, back to the show. So moving away from the socialization of medicine is what the Conservative Party wants, and rightfully so, and that's for many reasons. Now, what's been the process of this repeal? If you haven't been following it, if you're not, up to par with all your political knowledge, well, that's okay, because I've got you covered always on the Katie Sassine Show. So the process of this was Trump coordinated the repeal of Obamacare with Congress, and the new Congress got to Washington the first week of January and only had 2 weeks to push through this bill to partially repeal Obamacare. And now we know the White House, Senate, and HOR, they're Republican dominated, so that was a plus. But the fact was that the bill wasn't ready. So they had pushed the bill through just in time for Trump to sign on Inauguration Day. And then the bill did not pass, so now it would be put back on the table. And as I stated prior, likely in the fall after Obamacare premiums go up. So the Freedom Caucus reportedly acted unexpectedly with the passing of the bill, and they were against They were against Obamacare, but they helped save Planned Parenthood and Obamacare, and Trump commented on that. And they did not receive any votes from the Democrats in the House of Representatives for the bill. As expected, people are afraid to lose their positions in the House of Representatives, which is understanding. But at the same time, that's what Sean Spicer was referring to when he said people will be expected to vote, you know, according to what they think. And maybe not even what they think, but according to who they are and who the public knows them as. Because they don't want to lose their jobs. They don't want to lose their positions. They want to continue to be reelected and put back into their seat. So we have a few tweets that I'd like to show regarding the situation. Let's check them out from Mr. Trump and Kevin Corke. So here we see President Donald Trump says, Democrats are smiling in D.C. that the Freedom Caucus, with the help of Club for Growth and Heritage, have saved Planned Parenthood and Care. That was on March 26th. Kevin Corke said, and he introduced, you know, the video earlier on Fox where we featured Sean Spicer on breaking on whether the Freedom Caucus caused the bill to fail. And Speaker Ryan, I don't want to cast blame. That was stated. Now, that's fair, not casting blame, we understand. So, President Trump also said, Obamacare will explode and we will all get together and piece together a great healthcare plan for the people. Do not worry. Now, there are many people that disagree with Mr. Trump that believe, and this is, you know, conservative or liberal, they believe that the explosion of Obamacare is a huge overstatement and that it will fall apart, but it will not explode. And that's, you know, it's said very dramatically, but this is, you know, how our president expresses himself, as we have known from the very beginning. So am I surprised he described it in a more dramatic way? Not really so, but just for those of you who aren't used to his type of talk. Now, there is a man who spoke out on PBS against this bill that failed. So what I'd like to do is show a very good argument against the repeal of Obamacare made by Mr. Mark Shields, a PBS syndicated columnist. So let's check it out.
But first, the analysis of Shields and Brooks. That is syndicated columnist Mark Shields and New York Times columnist David Brooks. Gentlemen, I'm sorry there's no news to talk about today, but let's see what we can find. Mark, seriously, the move today in the Congress and by the president to pull this health care bill, what is there to say? I mean, the Republicans they said for months that this is what was going to happen.
The first thing, Judy, is, I think, a general statement. The Republican Party is an opposition party. It's a protest party. We have a protest president. We have a protest party. It's not a governing party. It showed itself unable to accept the responsibility and the accountability of governing. This bill was not a bad bill. This bill was just an abomination. There was no public case that could be made for the bill. There was no public argument that could be made for the bill because nobody knew what was in it. There was no public campaign for the bill because no organizations, every organization that cares was involved in medical care, whether it's the American Medical Association, the American Psychiatric Association, the American Academy of Pediatrics, they were all against the bill. It was a terrible bill. There was nothing organized. The only organizing principle was it was against Barack Obama. And Paul Ryan, a very earnest policy wonk, showed himself to be an inept political leader. He couldn't even lean on the safest seats in his own party's caucus. Those are the ones you say, these are people who are really not threatened for re-election. I need you. You have to vote. He couldn't even do that. I mean, and Donald Trump showed he has no understanding of the legislative process. He dealt in adjectives. It was wonderful, fantastic, glorious. He had no idea what was in it. The art of the deal just collapsed. And this is a man who gave away the store to the Freedom Caucus and got nothing in return, didn't even get their votes. I mean, on no count was this anything but a disaster politically and public policy and just for the country.
How do you explain it, David?
Well, all those things contributed. Trump's bad negotiation, lack of experience, the factionalism, and people talk about divisions within the party, blah, blah, blah. But the core problem was.
So, as we can see, Mr. Mark Shields is very passionate about his resistance against the bill to Trump Obamacare. That was the most complicated sentence I've said all day. Anyway, stay tuned in. We're going to comment on Mark Shields' comments as soon as we get back. I'm going to rehash some of the most contentious statements he made, so stay tuned in. Be right back with you after these brief commercials.
Hello, my name is Chad Watkins. I'm the manager at Larry's Body Shop. We are a family-owned and operated business and have been serving the North Georgia area since 1978. We are located at 1216 Progress Road in LOJ, Georgia. Our shop specializes in collision repair and we work with all major insurance companies. Larry's Body Shop is ICAR Gold, the highest role of training recognized by the collision repair industry. It is estimated that only 10% of collision shops meet these standards. Our shop consists of state-of-the-art equipment such as laser measurement system, down-drive spray booth, spot and MIG welding equipment. All of our paints are mixed on-site so that we can guarantee your paint to match every time. I know that having an accident can be a stressful event. We take pride in making sure our customers are satisfied with the repair of their vehicles. Our waiting area is clean and comfortable with free Wi-Fi and refreshing beverages. So if you're in an accident, stop by and see us at Larry's Body Shop.
El Rey and Ellijay.
El Rey Mexican Restaurant.
Family owned and operated and a local favorite for families, parties, and meetings.
Great prices.
Friendly service and delicious Mexican cuisine.
Patio dining available.
Come sing in Carlos's Cantina every Friday 9 to 1.
Eat in or take away.
Same location for 14 years. Open 7 days at the corner of Maddox Drive and 515. North Georgia's favorite Mexican cuisine. El Rey and Ellijay.
Ace is your helpful place for paint and home goods, tools, outdoor living, and lawn equipment. But did you know Ace Hardware of Blue Ridge is a little bit more? We have hunting rifles and accessories for your next hunting trip. We have Amish furniture imported directly from Ohio. And we have Ace Custom Woodworks for all your custom wood project needs, from cabinets to artwork. Ace Hardware of Blue Ridge, we have your new house in stock.
At Days Chevrolet in Jasper, we make everything better. It all starts with a huge new Chevy selection. Then we heap on the discounts to make sure your Chevy price is the lowest you'll find anywhere. And if you like great customer service, you'll love it at Days. Bigger selection, lower prices, easy financing, and great customer service. Your better day is just ahead at Days Chevrolet in Jasper, where new Chevys cost less.
Better days ahead, Days Chevrolet.
Find new roads.
Circuit World, brand name merchandise at unbelievably low prices. Furniture, appliances, and electronics. Circuit World is locally owned and operated, serving the tri-state area. Circuit World has highly trained professionals to help. Visit your hometown Circuit World today. 3 locations in Georgia: Ellijay, Blue Ridge, and Blairsville, Franklin, and Murphy, North Carolina. No credit checks, so let Circuit World deliver to you today.
What you gonna do with all that junk?
Welcome back to the Katie Sassine Show. as we saw in the previous episode, Mark Shields, PBS columnist, syndicated columnist for PBS, spoke out against the push for the repeal of Obamacare and the failure of the bill. And Shields, he berates Trump. He really does berate Trump and the Republican Party. And I want to point this out because he is a good speaker and he makes a great argument, but his arguments are based on false premises. So let's go through these quotes and analyze the issues with what he's saying and why what he's saying is essentially wrong, for the most part. He said, "We have a protest president, we have a protest party." Interesting and wrong. Mr. Shields is completely wrong. First off, the only protest in America has been against President Donald Trump. Mr. Shields, where have you been? The main protests in America have been against Donald Trump. The protest party right now is the Women's March, is Organizing for Action, is all of their subsidiary groups and subsidiaries and individuals that continue to put out an agenda based on false premises. So, he basically calls Trump the opposite of what he is by calling him a protest president. If anyone is a protest president right now, it is sitting President Barack Hussein Obama. That is the protest party. And his supporters, they're the ones who coined themselves as resisting the Trump administration. What is Shields talking about? The more you get into it, the crazier you realize he's sounding. But he sounds so eloquent when he speaks that you never would think the man was wrong. But when you really think about it, he's pretty much saying the opposite of what is real. But then he went on to say, it's a terrible bill. Now, the bill was not the best. It was rushed. So I give him that. Then he went on to say, the only organizing principle of this bill, of course, was that it was against Barack Obama. That's an interesting thought for someone apparently as close to Mark Shields, to Barack Obama, but that is not the truth. The organizing principle was that it was demanded by the people of the United States. And the people of the United States elected President Donald J. Trump. The people of the United States elected President Donald J. Trump that Shields is calling a protest president, and he's calling the Republicans a protest party now. So when did we become the resistors? Because last time I checked, the liberals were calling themselves the resistance. And there's even Organizing for Action by Michelle Obama and another founder that she's got along with her that is pushing for activism, speaking out against the current President Trump administration. So he's literally saying that Trump is the opposite of what he actually is. And people don't think about it. So they just believe it because he sounds smart, because he's a syndicated columnist. They just believe what he says. It is so wrong what's going on here in the mass media. It is so wrong. Trump, he also said that Trump shows that he has no understanding of the legislative process. Fair enough. You want to attack Trump because of his lack of experience in politics. Well, you're not bringing us anything new to the table because everyone knows that he's new to politics, Mark Shields. You're not telling us anything new. But you're letting the public know something new, that you are ill-informed about what's been going on in this country as of late, that you have no idea, Mr. Shields. Mr. Shields has no idea, apparently, about former President Barack Hussein Obama's shadow government operating in D.C. He's even got an army of agitators. Does Mr. Shields know about that? I don't think so, but I would love to hear what Mr. Shields has to say about it, that's for sure. So, now, we obviously got a good argument against Obamacare. Against Trump's effort to repeal Obamacare, the most recent administration effort to repeal Obamacare, which failed, unfortunately, and the bill will be put back on the table, no doubt about it, probably come fall, if not before. So, let's hear someone that expresses support for the repeal of Obamacare. Now, the interesting thing about this person is that they spoke out against the socialization of medicine before the Obama administration was, even a thought, and long before. And this sentiment about the fear of the socialization of medicine was expressed in 1961 by Ronald Reagan, and I want to share it with y'all right here, right now. Let's check it out.
Back in 1927, an American socialist, Norman Thomas, 6 times candidate for president on the Socialist Party ticket, said the American people would never vote for socialism. But he said under the name of liberalism, the American people will adopt every fragment of the socialist program. There are many ways in which our government has invaded the precincts of private citizens, the method of earning a living. Our government is in business to the extent of owning more than 19,000 businesses covering 47 different lines of activity. This amounts to 1/5 of the total industrial capacity of the United States. But at the moment, I'd like to talk about another way, because this threat is with us and at the moment is more imminent. One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project. Most people are a little reluctant to oppose anything that suggests medical care for people who possibly can't afford it. Now, the American people, if you put it to them about socialized medicine and gave them a chance to choose, would unhesitatingly vote against it. We had an example of this under the Truman administration. It was proposed that we have a compulsory health insurance program for all people in the United States, and of course the American people unhesitatingly rejected this. So, with the American people on record as not wanting socialized medicine, Congressman Farrand introduced the Farrand Bill. This was the idea that all people of Social Security age should be brought under a program of compulsory health insurance. Now, this would not only be our senior citizens, this would be the dependents and those who are disabled. This would be young people if they are dependents of someone eligible for Social Security. Now, Congressman Farrand brought the program out on that idea of just for that particular group of people. But Congressman Farrand was subscribing to this foot-in-the-door philosophy, because he said, if we can only break through and get our foot inside the door, then we can expand the program after that. Walter Reuther said, it's no secret that the United Automobile Workers is officially on record as backing a program of national health insurance. And by national health insurance, he meant socialized medicine for every American. Well, let's see what the socialists themselves had to say about it. They say, once the Farrand Bill is passed, this nation will be provided with a mechanism for socialized medicine capable of indefinite expansion in every direction until it includes the entire population. Well, we can't say we haven't been warned. Now, Congressman Farrand is no longer a congressman of the United States government.
Welcome back to the Katie Sassine Show. Very intriguing video right there, audio of Ronald Reagan expressing his concern of the socialization of medicine in the country and how it started with Medicare and Farrand, Amy Farrand, former congressperson. So, she is quoted as saying, regarding the bill, if we can only break through and get our foot inside the door, then we can extend the program after that. So right when Medicare came about, they were already thinking far into the future of socializing medicine, of requiring healthcare, of government ownership of healthcare. Now, Reagan expressed in this video that under the name liberalism, the public will be tricked to support socialism. And he also said that it is easy to disguise socialized medicine as a humanitarian project. Let me repeat that. Under the name liberalism, the public will be tricked, essentially, into supporting socialism. Liberalism sounds like a great term. It sounds positive. It sounds like liberty. It sounds like freedom. When in reality, what it does is impose control. So it's very tricky how they do these things, but if you analyze it, it's not so bad because the signs are all there. And Reagan went on to say that the new bill, the Farrand Bill, would be capable of indefinite expansion in every direction until it includes the entire population, which Farrand is on record of saying. through the quote that said, if we can only break through and get our foot inside the door, then we can extend the program after that. Farrand is already on record for saying that, and he just repeated what was stated by Farrand. Now, socialized medicine takes away the liberty of the doctor to control his or her number of patients, location of practice, etc. It exerts control. And not only that, when our government dominates our healthcare system, that's a huge sign of overbearing control, overbearing government control. I don't know how I can better explain it. The doctor doesn't have the liberty to control the number of his or her patients. Therefore, he or she cannot adequately supply care to all of those patients. That's why this is so important to consider. And we're even talking about the privatization of education for the same exact reason. Now, of course, it's very different, but it's also the same in certain aspects. Now, obviously, he's addressing socialized medicine as an encroachment upon freedom, which is what the Conservative Party believes that it is, to my knowledge. And this is why we will still push to repeal Obamacare. Anyway, stay tuned in for the next episode. We got to go for today. Remember, this is Katie Cecine Show. Follow at Katie FYNTV, and I'll see you tomorrow.